Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on the evolved randomized clinical trial recently published in JAMA. The evolved trial is the early intervention in patients with asymptomatic severe aortic stenosis and myocardial fibrosis. It was a multicenter randomized open label trial, 24 centers in the UK and Australia. Participants, 224 patients with severe asymptomatic aortic stenosis and myocardial fibrosis were enrolled. Intervention, early aortic valve replacement, TAVI or surgery versus guideline-directed conservative therapy. Primary endpoint, composite of all-cause mortality or unplanned aortic stenosis-related hospitalization. Key findings, primary outcome, no significant difference between the early intervention group and the conservative group. Mortality rate was around 14 and 13% in both groups, very similar. Unplanned hospitalization, lower in early intervention group, 6% versus 17% in the conservative group, p-value 0.05. Symptomatic relief, NYHA class 2 to class 4, better with early interventions, 20% in the intervention group versus 38% in the conservative group, odds ratio 0.37. Peri-procedural complications, low and comparable between the two groups. Clinical implications, early aortic valve intervention did not significantly improve mortality outcomes, reduced hospitalizations and better symptom control with early intervention. These results highlight the importance of patient selection for early intervention strategies. No increased risk of procedural complications from early intervention. Further research is needed. Example, the EASY Aortic Stenosis trial, EASY-AS trial, to confirm long-term outcomes.